Manitoba reported 54 cases today. That is down from Saturday's new one-day record of 97. And COVID-19 is hitting some there much harder than others, Indigenous communities especially. Austin Grabish brings us that story tonight.
I pray for our community, for the people, and for the ones that were positive with it.
Sunshine Bushy and her 3 kids aren't leaving their home in Little Grand Rapids. More than 24 people have tested positive for COVID-19. It's one of 9 Manitoba Indigenous communities reporting cases.
The current rate of hospitalizations for First Nations people in Manitoba due to COVID-19 is 10 times what it is for the rest of Manitoba.
The Assembly of Manitoba Chiefs says as of Friday, half the people in hospital were First Nations. The AMC says there are at least 60 active cases on reserve. People sick are as young as 1 and as old as 86. And half who've been diagnosed have an underlying health issue.
I think it's significant, but I think it's also a testament to what we already knew. Unfortunately, due to poverty and due to a lot of systemic issues, our populations have more underlying health issues.
That's why the Minister of Indigenous Services is so concerned about what's to come. Mark Miller says the COVID-19 infection rate on reserves has been continuously rising since mid-August.
Given what we have seen in the last 2 weeks, there is little doubt that the second wave of COVID will hit Indigenous peoples harder than the first wave.
Ottawa sent 2 isolation tents to Little Grand Rapids, with dozens more ready to go if needed. And the Red Cross has trained people in Little Grand Rapids and another First Nation on how to use PPE.
For my boy, he misses playing outside, but nobody can't go out.
With cold weather on the way and more forced to be inside, leaders are urging vigilance. Austin Grabish, CBC News, Winnipeg.